Hi, thank you for joining us today. I'm Bri Tally, and today I'm here with Kim Benson, a senior clinical therapist at InnerHealth, a premier behavioral health provider specializing in mental health and substance abuse treatment services. So today we're going to discuss how trauma affects various aspects of our lives, like our behavior, our interpersonal relationships, and overall mental wellness. And we'll offer up some tips how you can start making changes to overcome trauma and live a happier, healthier life. So, Kim, you're the expert on trauma. What are some of the ways trauma affects people?
It affects people in a lot of different ways. The most minor of things can cause someone trauma. For instance, if you and I were driving and we got a flat tire at 10 o'clock at night, it may make me absolutely panic. Being at night alone, I'm a woman, side of the road, I may go into just like freeze and just start crying mode. Whereas you're like, 10 minutes, I've got this, we'll be back on the road, and it'd be no big deal. Trauma is very different for different people. People can have issues and they brush it off like it's no big deal. Certain things impact others in variantly different ways. Some people can experience trauma physically, having been exposed to a different traumatic experience. When it's physical, people can have headaches, nightmares, chronic pain, digestive issues, lose their appetite, increase their appetite. They have a lot of physiological response. Other people have a lot of emotionality with it. Some people are extremely anxious. They get depressed, panicky, anxiety inducing, to the point where they are sometimes paranoid, nervous, can't really think real well or clear. The cognitive piece to that is that they can get distracted, not be able to focus. Mm-hmm. They struggle with who they are as a person, value, being able to put thoughts together, even things they may have known all their life, and all of a sudden they can't remember or anything like that. There are other things that people have behaviorally. They may start acting out depending on the age of the person. A lot of times trauma in children can be nightmares, bedwetting, not eating, hoarding, being clingy to a loved one. Others for adults could be just avoiding life, withdrawing, isolation, dealing in drugs, potentially self-harm, suicidal. There's a lot of different ways that people respond behaviorally, including risky behaviors. And we're going to get into some of those a little bit later, I hope. A lot of times trauma can impact them relationally. They can start to withdraw. They can leave a loved one. They can no longer be intimate or have sexual relations with someone. It may be acting out in any of those relationship areas, including self-sabotage in the relationships. And then another piece that a lot of people don't really take into consideration is the spiritual impact that trauma has. And a lot of people just assume spirituality is God or a religion, but spirituality is those things that bring you back to peace, center, and joy. And if that's the case, the spiritual implications sometimes cause people to not be able to have that meaning and purpose in their life. They kind of are just going around like a ship without a sail. They're having a hard time connecting to people, to finding what their true meaning in life is, even down to their sense of duty. For instance, even the way they parent, their value system, all those things can be impacted. And again, trauma impacts us all variantly different.
Yeah, so you kind of alluded to this and touched on this a little bit, but when you're talking about behavioral symptoms, you mentioned risky behaviors and other behavior like that. So what are some common ways that people negatively cope with trauma?
That's a really good question. And this is usually the tall tale signs for family and loved ones that they can start paying attention that something's wrong. When I was young, which is a long time ago, we used to be able to identify people who were going through something major. For instance, they'd start wearing all black, they'd dye their hair, their face would get pale, they may paint their fingernails, they stop with engaging with friends, they become loners, maybe they are dabbling in drinking, or they're smoking just cigarettes, or then they start smoking weed, or they started ditching class, their grades started to drop. We started paying attention to those signs and symptoms. But interestingly, people cope a lot of times with trauma negatively first. Most people don't just go, hey, this happened, let me hurry up and go get therapy, right? It's usually after several negative effects have come out first. Some of the negatives would be substance use, self-harm. People don't explore self-harm as much as they should. Most people just assume that means cutting. It could be anything from pulling out their hair, pinching, pulling skin off, causing themselves unnecessary grief and anxiety. For instance, feeling like I need to punish myself. Even if they're not the ones that caused the trauma, it may be punishment of self. For instance, if a trauma is someone was in a car wreck with a friend, the friend passed away, they lived, that survivor guilt can maybe cause self-harm. And then you have self-harm that goes all the way to suicidal ideations and even attempted suicides. People start to avoid, they isolate, they a lot of times blame themselves, or sometimes may even blame others. We hear a lot of times the word, but a lot of people don't pay attention to this word, is gaslighting. Which means I'm turning around and launching an attack to the person who's loved. Like if you and I were friends and you were expressing concern because you're starting to see some of these negative patterns in me, and I turn around and go, well, you suck, and this, look what you do, and you do all this, and what I'm doing is then turning around and trying to deflect the attention off of me, trying to make it all about you. That's gaslighting. That's real common when people feel judged, potentially attacked, or that they're being accused. Now, a person can come in a loving manner and still have that turnaround, which is, it's really a sad and unfortunate situation. Other people are in denial, they minimize. Some are extremely aggressive in their speech and their behavioral patterns. It doesn't always mean hitting. It can be threatening, tearing things up, throwing or destroying property, even destroying cars. I had one person extremely traumatic. Motor vehicle accident happened. A friend passed away. So he would borrow people's cars and wreck them on purpose. He had like 5 or 6 before people started paying attention that was his way to lash out. He was trying to die in response to living. So, people have a lot of different issues that they have. Some of the self-harm, they may even develop eating disorders and digestive disorders. So those negative coping signs and symptoms are really important for loved ones to kind of pay attention to. Now, sometimes any one issue may just be a day's stressor. When you start seeing patterns, that's when I usually tell people start cueing into those.
And notice that,
Yeah, for sure.
So with all of those negative ways to cope, how do you think different types of trauma can lead to or link or lead to an addiction problem?
That's actually a really good question. Most people, even in a treatment setting for, let's say, alcohol and drugs, people think that that's the reason that they're getting treated. Well, why are people drinking and using?
Right.
Most people are drinking and using in response to something else, an underlying problem or a core root problem. Oftentimes we find that traumatic experiences, no matter how that person defines them, can be the reason people start drinking and using. Well, sometimes drinking and using starts, what we always say, the famous one is Friday night lights. After the Friday night football game for teenagers, they sneak into their parents' basement or into their liquor cabinet, they sneak a beer. Typical kid stuff. We don't want that, but it's not abnormal, right? But what happens is they start finding more ways to utilize that. They start sneaking into the parents' medicine cabinet and finding somebody who has maybe anxiety meds that is for an actual true disorder. And that person is just trying to mellow or calm themselves. Then they go from high school to college, it's using it as a suppressant. I need to be able to calm my anxiety so I can get through finals, or I can study, or it's a lot of pressure going to school. Different things cause people to start developing. But then what happens is the mounting pressure of perfectionism or trauma And trauma needs to be identified. Trauma can look like anything. I had one patient who particularly lost a pet. It was a bird, right? And we don't usually think, some people think pets are just pets, they're expendable, it's no big deal. But they become friends, confidants, best pals.
Your family.
Yep, or like a child. This person lost a bird, and that particular incident, that bird was like 20 years old. And when the bird died, that person went into an extreme grief cycle of negative coping skills. So started drinking to cover up and numb. Well, each drug or alcohol does your body differently. You know, it has the effects of your body. So some people are, let's just use alcohol. They drink to numb so they don't have to feel. Well, I want you to think about something. If you're depressed and you drink, alcohol is a depressant, it's going to make you feel worse, right? Then you sober up, and then you really kind of feel bad about yourself, or, oh God, I shouldn't have done that. So we drink so we don't have to feel that. And then that cycle slowly starts to begin, that you almost can't get off that ride, for instance. But other things, people have childhood traumas. They may be adults now, or they were around when their parents were drinking or using. So it's not really their particular issue, but because they had to survive it.
Yeah.
Other traumas, death, divorce, a pet passing away, someone in the family getting very sick, diabetes, cancer, anywhere the sense of norms were rocked can cause somebody grief, and grief can become trauma for some people. Some people can handle things well. I want to make sure you understand. Just because somebody has a grief or a traumatic event happen doesn't mean they can't appropriately respond. But in the event that people aren't handling it or coping in positive ways, can obviously interact that way. So you have things like childhood experiences and adult experiences, PTSD, post-traumatic stress disorder, different addictions, physical traumas, people who have lost a limb, lose a really big job that they had. When the economy continues to do its ebbs and flows, and people lose jobs, or they have to consolidate. When COVID hit, a lot of people ended up losing long-term jobs they had had for a long time, and so that really rocked them too. People who are amputees, war veterans, these are all things that can be very traumatic to individuals. But the other piece a lot of people don't take into account also is the emotional traumas that people have. Emotional traumas are typically the ones that we find hurt the worst. The emotional traumas are the ones that I can mask if I don't want you to see it. If I'm really depressed, I can walk around going, I'm fine, right? That's the biggest lie women tell. I'm okay and I'm fine, right? Which usually is indicative that something's not. We can put the mask on for the outside, but we can't mask the in. Also, we tend not to come forth and ask for help in fear of ridicule, judgment, people thinking we're weak or a punk or something like that. So we end up internalizing or stuffing it, and we don't usually get the treatment we need. So a lot of the emotional is what we end up finding is the thing unprocessed for people. So that link between that trauma and addiction is to help them numb, to help them cope, to help them not feel that way, or to remove themselves from that emotion or feeling for even a brief time.
So people can cope a different way. And you mentioned that trauma can be anything, and it's different from anybody, from something physical to something emotional. So what do you feel are some of the main reasons why people don't seek help with their trauma?
That's a really good question as well. A lot of times it's inconvenient, cost, fear of ridicule, judgment. A lot of people don't want to shake up the family if they say something. That's why a lot of the childhood suppression happens. They don't want to be deemed a bad girl or a bad boy. They don't want to wreck a marriage. They don't want to cause chaos or trauma or drama. They don't want to cause discord. They don't want to be outcasted. They don't want to be deemed as the person who was the reason the family broke up. Other people, there is a huge, I don't know if you've seen it, it's mental health matters, the hashtag mental health
Yeah.
matters. And it does. But people have a negative stigma about therapy. Oh, you must be crazy going to sit on the couch.
Yeah.
That's not the case at all.
Right.
I always tell people it's good to do just mental check-ins and checking in with yourself before crisis happens, right?
Yeah.
But I think a lot of people, there's such a negative stigma. If I said, I go to a therapist, oh God, you must be crazy, right? There's
what are you going for?
Yeah. And the sad thing about that is that because there's such a negative stigma in society amongst social medias and things like that, people don't in fear of what could be judgment, all of these things. But I tell people your mental health does matter. So taking that away, that stigma can be absolutely powerful. Other reasons that people don't get help, oftentimes they don't know they should. I've had a lot of people who are like, I didn't know that was wrong or a problem, or, one of the really neat things in being in the position that I am, I get to link what I'm seeing with past traumas or past events that maybe they didn't deem as traumatic in the beginning or when they looked at it. And you can actually start seeing links. So maybe they didn't know they needed it, or maybe they didn't know there were resources available. Some people don't know what their local community resources are. They don't know where to go. A lot of times we're seeing, oh my goodness, is such a lack of trust. When people are traumatized, specifically where there's been a breach of trust or a violation of a person that you felt safe with, now I don't trust. For instance, if maybe you had been traumatized by a woman, you may not feel comfortable going to a woman for that because maybe you don't trust. Or, that lack of trust because someone in a powerful setting, in an accountability role to you, in a parental or a role like a policeman, a fireman, a teacher may have been the violator, or a preacher, could very well be the reason. Now you've taken my vulnerability, and because I've had my vulnerability at risk, I'm not trusting anymore. And especially depending on how a person may have been traumatized or violated, that can cause a lot of trust issues for them not to want to do that. The other thing is they sometimes fear that they may be re-traumatized just by retelling the story. If I just sweep it under the rug and act like it doesn't matter,
it doesn't
exist. Yeah. So that is unfortunately a negative. The one unfortunate one that I see oftentimes is they think time heals all wounds. We've heard that forever. Time doesn't heal all wounds. You need to process it, and in time you can heal. But it takes time, and a lot of people just assume, well, I'll get over it. Well, sometimes you don't, and that's really unfortunate. The last one that we find sometimes are cultural or religious beliefs. A lot of time, and a lot of people think, oh, in the American culture, we know about mental health, it's no big deal. Well, beyond the American culture, we have people who are of different socioeconomic backgrounds, different genetic backgrounds, different racial backgrounds. A lot of times you're told, I know when I was coming up, you don't tell family business ever.
Right.
And so what happens in this house stays in this house. When you are pre-programmed that it needs to stay here, it can be quite difficult for you to open up to a stranger and tell your business because there's a fear of what you might think of me and my family. So cultural beliefs, and then a lot of times people don't go unless it's the same religion. Like a Christian will only go to a Christian counselor. A Jewish person may only go to a rabbi or a clergyman or something like that. And what people need to understand is regardless of somebody's faith preference or lack of faith preference, that help is available for whoever you are, wherever you are, without judgment.
Yeah.
That's the piece. Your therapist should create an environment where you feel safe without judgment.
Yeah. And you kind of touched on this, but as in people thinking out of sight, out of mind, my trauma doesn't exist anymore because I've kind of swept it under the rug. That can be dangerous. What are some of the dangers of leaving your trauma unresolved?
If I asked you to clean this room and you cleaned it top to bottom, but everything that fell on the floor you swept under the rug, is the room technically clean?
No.
It's still there, right? Usually what happens is people will do that. We compartmentalize. We put it over there, we'll deal with it later or whenever it comes up again. Unresolved trauma almost always comes back up again. What happens is it comes back up and you didn't realize it came back up, or it's suppressed and then all of a sudden, boom, it explodes. And it's not in reference to that issue usually. It's some other event or even just a regular situation that should have just been real easy to handle, and somebody explodes. And it doesn't mean it's going to end in violence, but usually it ends up being unresolved issues that come back out. We always try to tell people the sooner you can start processing the traumas, the better. Because if you prolong it, it affects how you live. You create maladaptive and unhealthy coping mechanisms and coping styles and defense mechanisms in responses to traumatic events that you use over a period of time. Well, when you have negative coping skills and maladaptive patterns that you're starting to do, you're affecting the relationships that you have, the way people see you.
Yeah.
All of us know, like in your neighborhood, you know this old man at the end of the block who's crotchety. He's just mean and hateful, and he's not nice to anybody.
Yeah.
Well, you ever asked why? Okay, we've seen the movie Up, that cartoon movie Up, right?
Yeah.
And the old man's kind of persnickety and he doesn't really want to be bothered. Well, the reason he doesn't want to be bothered is because he's grieving the loss of his wife and he's not getting help. He's trying to attribute to her his own way without being intervened on, right? And so people respond variantly different. But if you don't get the help you need, it may manifest later in your life and in a larger way than if you would have just sought help for it earlier on. Also, in reference to that, people can have other problems that result from unprocessed trauma. For instance, they can have long-term physiological problems. It can cause digestional issues, hypertension, high blood pressure. It can agitate other conditions, diabetes, stroke, heart attack. It can cause people to have ulcers, headaches, things of that nature. Not processing trauma can also lead to predisposition to other genetic diseases or complications.
Yeah.
Including people who are maladaptively coping, including drugs, alcohol, unhealthy or risky activity, can result in untimely death or early on death, whereas somebody could have lived really, really long life if they would have gotten help and was able to handle it so it didn't affect them physiologically.
Yeah.
So I just want to make sure to add that too.
That's when you can see it, is when other people are struggling physically. You know that something is going on, like you mentioned earlier, when you can physically tell. And that sounds like it gets worse over time. And
you're right. And even as you mentioned that, something good to note, that would make an outside person be able to take notice. But how long have they been suffering inside when it's first now where you can see it? It could be months or years down the line that you're now starting to see someone's losing weight. They're starting to get dark circles under their eyes. They're not, responding right. Now you're cued into it, but how long have they been suffering in silence? That's why if we could get someone in earlier when an actual traumatic event happens, the better. You'll start to see this in the media now. When there's a school shooting, they bring in counselors to help, right?
Yeah.
They have, when there are other mass shootings, police departments and fire departments now have counselors and psychologists that go to the station houses and stuff like that to be there to help decompress even the first responders.
Right.
They now are starting to employ psychiatrists and psychologists on medical staffs at hospitals to be able to help the staff who have to deal with, the geriatric unit when elderly people die, or in the emergency room when they're seeing all of these traumas that are coming through. And different things like that. So people are starting to respond to that. But what happens to the other things that aren't seen, or somebody that's not a first responder. That's why it's really important to get care for trauma.
Yeah, and talking about and getting care. So we talked about how people cope with it. What are the risks and the dangers of leaving it, like not dealing with it? What are the best therapies to help people work through trauma?
That's really good. As a therapist myself, one of the things I say that getting into therapy doesn't just mean you're sitting on a couch talking. Most therapists don't even have couches anymore. It's old school, right? But doing talk therapy and psychotherapies help. Dialectical behavioral therapy, or also known as DBT, cognitive behavioral therapy, CBT. There are several others. Even there are medicines that can help to alleviate the physiological and the anxiety, depression symptoms that people have. Now, I'm a person who I always tell people you should also address it clinically, not just medically, so that you can help to really talk through and process what you're going through. EMDR, which is eye movement desensitization and reprocessing, is really good for trauma and long-term trauma. You have exposure therapy. There are so many different disciplines of therapeutic approaches that can be helpful. My strongest suggestion is get in and be assessed. I'm the kind of person, I use a lot of different techniques with people. I can't use any one technique with everybody. It doesn't seem to work well. People aren't cookie cutters. So if a person can get in with a professional and get assessed, they can find out what they need, and
what'll work for them.
Yeah, and not everything works the same. Like I have some patients, I can't do therapy in an office. I actually take them out for a walk. We go walk through nature. I've had some younger people take them out and play basketball or throwing a ball together. They're talking the entire time and they don't realize they're in therapy. All different kind of techniques can be utilized, but go and get that assessment. It's not difficult. You don't bite. So I tell people, get the assessment that you need and let's figure out a plan for you. And they're fluid. They can change as things are uncovered and exposed, and find out what works best, what doesn't, and kind of map out your own plan.
Yeah, and go from there.
Yeah.
So what would you recommend for people who need help dealing with unresolved trauma?
Start now. Don't put it off. Procrastination is a disease in and of itself.
Right.
But it's your mental health that matters. The airlines have it right. In the safety briefings, they say, put your mask on yourself first before trying to help others. One of the main key things people who had to deal with trauma do, they want to fix everybody else. They go into, let me just go be mom, let's be dad, let me be employer, let me be all these things, caretaker. It's easier to deal with other people and their issues instead of dealing with me. So my strongest suggestion is take the time for yourself, get the self-care you need, get the treatment that you need, and see if helping yourself first doesn't make a huge difference, because your mental health does matter.
That is a very big takeaway. And thank you so much, Kim, for talking about how trauma can affect us and what we can do to deal with it and be more proactive in our approach, and so that we do live a great life, an enjoyable life. We don't have to constantly be focused in dealing with our trauma if we start now.
That's right. Remember, you're worth it.
If you need more help or guidance, you can reach out to the experts at InnerHealth by calling 800-388-4601 or by visiting innerhealth.com today. Our intake specialist will answer any questions you might have about trauma and addiction.